So, good day. I am Archie Tapia from SM1C. So, today I'm performing the psychological assessment. So, first, we prepare the necessary equipment needed. So, we have the sphygmomanometer and stethoscope and thermometer, tuning fork, the cotton applicator, the tongue pressure, and also the clean gloves. So now, first I introduce myself to my client and identify my client first to ensure that we have the right client in front of us and explain the procedure. So, sir, I am actually Tapia, your student nurse for today. So, what is your name?
Saya Rama.
Your age?
I'm 18 years old.
Your birthday?
September 30.
So, for now, sir, I will assess your body from head to toe. What's called one cephalocaudal assessment. So, to ensure that everything is normal, if there is abnormalities, you can um, document it findings to prevent it earlier. So now we position our client appropriately and make sure our room is warm and adequate light. And also, if there is any curtains or doors or screen, we must close them to provide privacy to our client. And now we obtain the history of our client. So, sir, you have been encountered illnesses or pain last few days.
No, sir.
You have been admitted in the hospital last month or last year.
No, sir.
So now we perform hand washing to prevent the spreading of bacteria and viruses. Now for vital um, taking, so we check for his blood pressure, his respiratory rate, and temperature, oxygen saturator, and pulse rate. Now, now for the oxygen saturation and also the pressure. We use pulse oximeter. And for the temperature, and now we assess for the respiratory rate. So now for the BMI, so we collect for the height and the weight for our patient. Okay, so okay, so now we go into the performance base, which is the head. So we observe for the size, shape, and the symmetry of the head and the scalp. So first, we use gloves. So the head of my client is symmetrical, round, and right in the middle, which is normal. Then we palpate and note any deformities, um, depression and lumps. So there is no sign of abnormalities. or like hydrocephalus. So our client is straight, um, smooth, and odorless. So now we are going to the face of our client. So we inspect for the facial expression, involuntary movement, muscles, and edema. So I notice relaxed um, expression, and there's no sign of edema or lesion of our client. So overall is normal. So next, for the eyes, we see the position and alimentation of his height, of his eyes, and first we stand front of our client. So, sir, you recording. And we inspect the both of his eyes for position and alignment. There is no deviation and abnormal proportion, and his eyebrows is normal. There is no sign of sorophobic dermatitis, and there is no presence of edema, lesion, or any condition on the eyelashes. And eye look, there is no excessive tearing, dryness of his eye. And we expose the sclera. Sorry. Okay. So to know if he has jaundice, anemia, or infection, but my client has a transparent white color of sclera. So we record it to the record frame. And I notice there is no nodules or swelling and redness. And for the cornea transparent, no abrasions. And for the pupil size, this is, shape is equal and round and symmetry. So now we are going to the papillary response to light. Sir, look into the distance because I light a torch from the side of your eye. So when enough for the coordination of the eye movement, so we hold a object at the distance from the client and ask him to keep his head still and follow the object with his eyes only. Sir, may keep your head still and follow only the object with your eyes. So there is no abnormalities and overall is normal. And now for the convergent convergence convergence test. So we ask the client to follow my finger as I move it toward the bridge of this nose, as long as my client has increase. Okay, so sir, can you follow my finger, sir, toward to your nose bridge? So it's look my client has a normal vision. Now we inspect for the nose. So there is no inflammation or swelling, and the nasal septum is on the center, and we palpate for the tenderness. So any tenderness, sir. And now we inspect for the mouth and lips. So there is no sign of hydration. The color of his lips is pinkish and symmetrical. So you may open your mouth. So now we're using our tongue displacer to inspect for the gums and the tongue and also the teeth. So in his gums there's no any bleeding or lesions. And for the teeth, the discoloration is normal. In the number of tooth, normal. There is no absence of one tooth. And for the tongue, has a normal texture. And the color is pinkish. So it is. So now for the ears. So we inspect for his ears. So as I observe, he has a normal position of the ear, the color, and also the texture. There is no sign of any inflammation or lesion. So any tenderness, sir? Okay. Now for the auditory equity, we perform the voice whisper test. So we cover our mouth for the liquiding. So sir, you may repeat the words that I say.
Okay.
So airplane,
Aeroplane.
hospital,
Hospital.
and now for the tuning fork test. So from the Weaver test, we first tap the tuning fork and tap it at the forehead of our client. You terrible person. And for the ring test, we also tap the tuning fork again and place it at the side of his ears. You hear any vibration, sir?
Yes.
Until the end. You hear any. So now we are going to the neck for range of motion. So we ask the client to touch the chin to the chest. So now may I ask you, sir, na if okay that I can turn your head left to right and upward to downward? Do you have feel any pain, sir?
Okay.
So okay. So we will record it. inspection, anterior and lateral thorax. So, sir, we get up your, and now we position our client appropriately. So you may chest out, sir, to see. So we inspect for the body color. So it's the body symmetry. The instructional, how we inspect the instructional structure of thorax. And inspect for the configuration. And count the respiratory rate. You can inhale. So they have a normal respiratory rate. And now we are going to inspection for the posterior thorax. May the skin color. So skin color. And we inspect the structure of the posterior thorax. So there is no sign of abnormalities or any. And inspect for the symmetry. So the posterior thorax is symmetrical. And we observe lastly the respiration. So sir, you may inhale and exhale. So as you can see or observe, he has a normal respiratory rate. Now we are going to the palpation of the posterior thorax. So first we lightly palpate the posterior thorax. And then we palpate and count the airways of the intercostal spaces. Now for the palpation of the respiratory expansion. So you may inhale, sir, and exhale. Inhale. Exhale. Inhale. Exhale. And then we palpate now for the tactile premus using the palmar surface of our hand. 99. So now we are going to the percussion of the posterior thorax. So now we palpate the lungs. So now we are going to the auscultation of the posterior thorax. So now we are going to use our stethoscope. We inhale and exhale. So now for the palpation of anterior and lateral thorax. So now we position our client. So we palpate the sternum, ribs, and intercostal spaces. And lightly palpate the anterior and lateral thorax. And palpate the respiratory expansion. And now we palpate for the tactile kinecus. So we use the ulnar surface of the hand and palpate and compare symmetric areas of the lungs by moving forward side to side from slices to bases. So sir, you may say the 99 number, repeat it.
99, 99, 99, 99, 99, 99, 99, 99, 99.
So, okay. Percussion of the anterior and lateral thorax. So, sir, you may transfer and chest up. So, okay. Sir, you may turn your hand up in the opposite side. So now we are going to auscultate his anterior and lateral thorax. So now we use our stethoscope. So we auscultate his trachea, aspices, and bronchi. Now we proceed to the assessment of the abdomen. So in preparatory phase, we expose the abdomen to be fully visible, and our client should be empathize the bladder and keep the room warm, and the stethoscope in also our hand. So now we help our client to in supine position. So now we inspect for the abdomen, the contour. So he has a normal range, flat to rounded, and also his symmetry. There is no sign of bulging visible masses or any asymmetric. And also the skin, there is no scars or lesion or any torture. And also this umbilicus, we observe its contour, location, and inflammation borders. So normally it is in the midline and inverted. So now we are auscultate the vascular sounds and the bowel sounds. So now we use our stethoscope for the vowels sounds auscultation. So in the right upper quadrant, in the right lower quadrant, in the left upper quadrant, in the left lower quadrant. So as I observed, he has normal sounds, the vascular sounds. So usually there is no present sound, so which is normal. And now for the extremities of the lower and upper body. So first we inspect for the joint of the jaw, both sides. And sir, you may open your and bite down. So now we assess for the sternocleidomastoid. And sir, you may turn your face from side to side and up and down. And we repeat again the procedure with the resistance of our hand. So look up to the up. For that, we access from the AC joint and then palpate over the top. So anything there next? Anything there next or anything? So now we evaluate the elevation of his shoulder. So as I can see, there is no sign of scoliosis. So now for the range motion. So sir, you may arms sideward to the abduction. and down for the induction. So okay. So now for the flexion. So sir, you may arm straight for the assessing of the flexion, and for the over. So now for the assessing of the internal and external rotation. So sir, you may cross your arms back like this. So as I can see, they can close her finger together on the both sides. So okay, the same as the. So now we can shrug the assessing the shrug of his shoulder. Pull out. Pull in. So okay. So now for the elbow. So we assessing for lateral and the medial. So ini tenderness. Ini tenderness or pain. And now for the tinal sign. So we inspect the tenderness of his wrist and then tap it. Tinitingling siya.
No.
So as I observe, there is no sign of carpal tunnel syndrome. Tinitingling siya.
No.
So also there is no sign of carpal tunnel syndrome. And now for the paddles sign. So we close the dorsal surface together of our client. So we wait until 30 to 60 seconds. So okay, now we assess for the wrist and elbow strength. So by making fist motion, so in one, upward. So now for the range motion. So sir, you may eating. And now we palpate the finger of patient, the joint of his finger. Going to the lower body. So now we assess the hip strength. So we use our hand to stabilize the back of our patient. So sir, you may raise your leg one at a time. So okay. So sir, you may lay down. So now we hold the ankle with dominant hand, and also we hold the knee with non-dominant hand. So you may push and pull. Push. Then push. Oh, sir, you may sit now. And now we make findings. So, sir, after I assess your body from head to toe, so there's no any abnormalities in your vital signs is normal, and also your BMI normal. So if there any abnormalities, we document it in findings.